Hi, I'm Justin Ott, physical therapist and founder of Ott Physical Therapy. I'm here today with an old friend of mine, Maria Heston. Maria, can you tell the audience a little bit about yourself?
My name is Maria Heston. I've been a physical therapist for 26 years. I graduated from Boston University with my master's in physical therapy in 1999. Since then, I've worked in quite a few different settings, starting off with my first job at an orthopedic teaching hospital in New York City, soon moving on to work as a concierge PT, working backstage on Broadway shows, which I still continue to do to this day. My experience in the theater led to my introduction to ART, active release techniques, which has since become an invaluable tool in my practice for the last 10 years. I'm a certified ART elite provider. I now work for ART as an independent contractor under the subset of ART Corporate Solutions, providing PT in workplace settings. I continue to work as a per diem therapist for the theater, and I also work part time at Twinborough Physical Therapy, the clinic that I have been working since I moved away from the city in 2015.
And you touched base on a couple things I really want to dive in here today with you. Your expertise in active release techniques. I want to know all about ART and when we can talk about that, but also a little bit about something that's very special to you and unique. I remember you telling me about being a Broadway PT and what you would do with that. So that's not something that I have any expertise or any experience in or knew anyone that did that. So can you tell a little bit more about that experience of yours?
Sure. Well, it started as a fortunate opportunity, just being in the right place at the right time. And that place happened to be New York City in the 90s. So, not to age myself, but in 1999, I got my first PT job at the Hospital for Joint Diseases, um, which is a horrible name now. They changed it. I mean, looking back now, not a great marketing strategy, but now it's called NYU Langone Health. Working at HJD was an incredible experience. It was a top tier teaching hospital, and I had the chance to rotate through acute care, ortho rehab, neuro rehab, which I absolutely loved and thought that's where I was staying. But once I did my rotation in outpatient, I mean, it just really clicked, and I just knew I landed in the place I wanted to stay. So I was lucky enough to be surrounded by therapists who split their time between our department and the Harkness Center for Dance Injuries, which was located just across the street. Harkness was part of our hospital, and they functioned with the Sports Medicine Center across the street. So, and at that point, I hadn't even considered dance medicine, but working with these other therapists and their approaches to treatment really fascinated me. And I was constantly pulling one of them over to the side, asking, show me how to do that. Can you teach me that? And I think they were just getting sick of me asking them all the time, even though they were very generous with their time, mentoring me. But they did guide me to the courses I needed to learn the things I was asking about. So I started taking classes with the Institute of Physical Art, also known as the IPA. And not many people here working in New Jersey, I feel, know them too well. But in New York City, it was a very known entity of places to take continuing ed courses. But I took my first soft tissue mobilization class, FO1, and I was instantly hooked. And I ended up taking like every course they offered. FO2, functional mobilization for upper extremity, lower extremity, PNF gait, back education training, all taught by Greg Johnson. And then I moved to the osteopathic track taught by Jeff Ellis, diving deep into cervical thoracic integration, lumbopelvic integration, learning the ins and outs of type 1 and type 2 dysfunction, SI joint dysfunctions, which became a real love of mine treating those. And I took the courses multiple times. I loved the content, especially the osteopathic techniques, and I wanted to go even deeper. So this soon led me to Michigan State College of Osteopathic Medicine, where I studied directly with the original sources who taught the Jeff Ellises of the world. So that was amazing, got me more astute and finer with my skills with muscle energy technique, exercise prescription, getting it straight from the source. And the best part was my hospital covered all of it. Amazing continuing education benefits. And so this is what got my foot in the door at my first job at the Lion King. I had a colleague who reached out to me. She was working backstage for them at the time, and she was relocating to Florida and wanted me to take over for her. So I was hesitant because I was not a dancer and I didn't think I could do it. And she told me to get over myself and just take a few dance classes, if I, really felt that anxious about it. So I did. Not to become a dancer, but I took some ballet classes to grasp the biomechanics and fundamentals of movement, turnout, alignment, pliés, relevés, rond de jambe. Um, and it definitely helped my confidence. So I interviewed with Neurotour, the company that held the contract, for the show. I got the job and soon began what would be the start of my career in Broadway physical therapy.
I've worked in acute settings, inpatient rehab, level one traumas, outpatient. I've worked with professional athletes. I've got friends that work with the pro athlete teams. But you're one of a kind where Broadway is such a unique atmosphere, environment. It's not like an outpatient clinic. It's not the same structure of it. So when you're actually in there and doing these shows, whether it's Lion King or whatever you're working on, what is it actually like to show up at work, and what is a work day like for you when you're doing this?
Well, for all my shows, I'd go in 2 to 3 hours before curtain to treat cast members for quick 20-minute sessions. So you could sign up whether you were in ensemble, if you were a principal actor, if you were a crew. The crew as well got a lot of injuries from wardrobe to key grips to electricians, doing a lot of like fine motor movements. For The Lion King specifically, I stayed through the entire show to treat performers between the musical numbers. So I'd work before curtain and then during curtain, act one, intermission, act two, we'd have sign-ups. I'd usually treat the older lions in act one, like older Simba, older Nala, because they didn't go on until act two. And the younger lions I could treat in act two because they were on in the first half of the show. So everyone timed it that way, and they timed their sessions by musical numbers. That's how we track the flow of treatment. Not by time, but by cues from the show. So there was a monitor in the treatment room, and so I could know exactly where everyone was in the performance. And dancers could pop in and say something like, "I'm going to come in right after Shadowlands," or "Can you work on me right before the final busa?" And I would know exactly when to expect them. So, all in all, from a business perspective, the theater company, that was hiring us saw real value in investing in on-site PT because this was, to avoid the cast or crew from missing work or turning into a workman's compensation case, which eventually saved them like big time in production cost in the long run. So, all in all, it was very, very worthwhile for them.
It sounds like it's a very touch and go kind of scenario too, where you do what you got to do when you got to do it to keep the show going. The show must go on, right? So,
Absolutely.
and I remember in Pittsburgh, there was a couple of the Pittsburgh ballet dancers that came in, and it's crazy. It's a whole different kind of person or client that you're working with too. Because I remember seeing one girl, and I can't remember all the positions anymore, but pretty much just standing on one toe completely up. And the PT that's working with them is like, "What do you think's wrong with them?" I was like, I don't know. They're standing on one toe at the bar with the other leg up over their head, and they're like, their ankle's really stiff. And I was like, I don't know about that, but the demands of what those jobs are and those performers are.
Oh,
It's a very, they're working at a very high level too. So it's unique to be able to come in and apply things that can keep them going and progressing that. And I think that always stood out with me that working with you, you're so hands-on. You do have an eye for things. You were giving me a whole course to do SI, and you picked up on my little impairments that I didn't think you were going to get, and you did it in 2 seconds without me giving you any cues. So you got an eye and an act for it. So that's definitely a unique thing. So when you're actually giving different treatments to some of these performers, what is that like? What kind of things do you offer when you're doing the show?
well, you have to be, work with what you have. So a lot of these shows, it was nice in The Lion King to have a designated treatment room where I actually had my treatment table, 50 different shades of kinesio tape, a cupping set, I have weights, I have, a pretty much, a full set of tools to work with. But in most theaters, especially these smaller New York City older theaters, you're in a balcony or box seats with a privacy screen in front of you. And really your treatment tool is your hands, and that's what you are working with. So my go-to techniques, I'm always first identifying postural asymmetries. I love starting with the pelvis first. I mean, no matter what you have, I just go love going starting from my center, working up, working down, working outward, identifying postural asymmetries, then employing movement tests. Okay, we know what it looks like statically. What does this look like now for a movement test? What's not moving correctly? And after identifying, then I move into my ART. So I can identify how is the soft tissue muscle imbalances affecting this. Do we need to release a psoas and iliacus? Are they causing an anterior innominate or posterior innominate, an upslip or downslip? Working with ART first, and then going into muscle energy techniques, which I find is the safest tool that offers the highest benefit with the lowest risk. Because you're using, especially on this hypermobile population, instead of manipulating someone back into place, which could cause a lot more hypermobilities, you're using a technique that is actually stabilizing while it's mobilizing. So you're reinforcing that neuromuscular control through dynamic movements by using muscle energy. So that is my go-to for treating sacral torsions, innominates, rotations, upslips, downslips, lumbar spine, ERSs, FRSs, because they're such stabilizing contractions. And then after this, we're not done yet. Now you have fixed it, you've mobilized it. Now you need to re-educate the movement because now they've been walking around with this faulty pattern for so long. Now you need to facilitate the dormant muscles that haven't been firing through your hands. And this is where PNF comes in. And Justin, I know you love PNF, and I learned so much from you about PNF when you were at our clinic, and we just fangirled over it. But especially with the scapula, right? So placing the scapula, setting it into the proper position, getting it out of its, forward protracted position, setting it back, then retraining the movement into anterior elevation, posterior depression, getting those specific muscles to fire to take us into it. We need to use a combination of isotonics. So I always say if someone is not performing the movement correctly while you're doing your PNF techniques, it's the therapist's fault. Your hands are not in the right place. So as long as your hands are in the right place, you're going to get the contractions you want. You're going to facilitate that upper trap levator scap into anterior elevation. You're going to facilitate that lower trap into posterior depression. Then you can add on your combination of isotonics. And you've heard me say a lot, like, you're going to win. I'm going to win. And back and forth. That's me, encouraging a concentric contraction. And you're going to win. They push down. Excuse me, that's my concentric contraction. I'm going to win. Coming up. That's my eccentric contraction for the lower trap. They come down again concentrically. Now you're going to hold. There's my isometric. That's going to reset the shoulder gird, reset the scapula. Just as an example, you could do the same thing for the pelvis. You could do the same thing with mass scapula and pelvic patterns at the same time, working in elongation and shortening techniques. But all this is to reestablish proper postural alignment and get the right muscles facilitated so that we're not just going to use the same faulty compensatory patterns. And after we restore that correct movement, then I'm going to give you some exercises. Then I'll give you some TheraBands to start exercising it. But I need to buy you that correct movement first.
I couldn't agree more. And there's a couple of key things that you said that really stood out to me that even from the beginning, your eyes, your hands, those are the strength of a PT. A good PT can get those things on you and make a huge difference of it. And like you said, if you're not retraining or getting the hands on a patient to really have them feel the motion that you're trying to get them to do, you always hear in documentation, the visual, the verbal, the tactile cues that are going in there. But what does that really
Right.
mean? And there's one thing to just show someone like, that's what I want you to do. But for them to incorporate that and move their body differently,
Exactly.
it's so much
Yeah.
harder. Just change a behavior. We all know that. Bad behavior is not an easy thing to just change in a second. So when you're getting your hands on, and this is kind of like switching from Broadway shows to do our own dance, when you're getting your hands onto someone and yeah, you're working with them. There's a movement. I want them to feel what I feel and I know so that they can
It's a
carry that
dance.
over and then they
Hmm.
can build off of that. And then we can go into the exercises that are going to kind of reinforce that. So I think that's all great information that I couldn't agree more on you. And I always try to get my hands on. And that stood out to me when I was early. One of my mentors was just like, if you're not spending some time with that patient, getting your hands on them, you're not doing them justice. There are certain gifts that we have that we can
Absolutely.
teach. So I think that's all great information there. And I do want
And
to
it's
dive in.
really all you need, right? Like you can be creative in these spaces where you're a table in a bathroom at some of these shows. You're in a closet. You're in again, like in a wig room. That's really all you have to use. But really, that's really all you need. Like in those settings, that should do it.
But I'm sure you get it. It's almost like a party trick sometimes. You've been around long enough that I'm sure it's happened to you where someone's, hey, you're a PT, and it's a family friend you're seeing at a reunion. And I just look around, I'm like, all right, we got a chair there. There's a table that's not going to collapse if you lay on it. Like, come on, let's get this going right now. Like, I don't need to
Right.
be in a clinic to and be able to necessarily do that. It's difficult doing things virtually. So there is a huge aspect of getting your hands on someone that makes a huge difference. But that's everything that we've learned and trained from we take with us all the time. That is our toolkit. So, and part of your toolkit, the ART, we talk about a lot.
Oh,
I love it. You're the one that kind of turned my eye on it to be how will this incorporate in my practice, and it's something that I continue. Well, we continue to be trying to incorporate and learn more about it. But you have done training on it. Can you tell me a little bit specifically, like active release techniques? What is that? What is it good for? When do you incorporate that? I love that you were talking about muscle energy techniques because when I was first, I was like, oh, I can manipulate it, I can mobilize it, I get that cavitation, but that's not always appropriate.
you just have to be strategic with the patient you're working with. So just
Exactly.
I've talked muscle energy technique a lot, specifically for dancers, because again, they're hypermobile. But again, some of the guys you work with, absolutely, they might need a manipulation, and that's the best choice of treatment. But it always depends. It's always unique to the person that you're treating.
The
Yeah,
more tools that we have as therapists, the more options we have to better suit the
absolutely.
specific patient needs. So I love this, but yeah, I'll let you take the floor on active release techniques. Tell me everything you know about it.
So I got involved with it while I was in the theater, and they basically said, "All right, we're doing this now. Like we want all our therapists, our IPA trained therapists, to now start taking these ART courses. Our dancers love it. It's working great for them." I was like, okay, so it's basically it's a hands-on therapy method designed to treat muscles, ligaments, tendons, nerve, fascia, and but it also there's protocols for the menisci, joint capsules, shoulder capsule, hip capsules, and just things that, especially the nerve courses, there just haven't been courses like this where you feel like you have this hole in your treatment box, right? Like where you're just like these complicated cases, those little meniscal tears, right? Those sprays that we get that, they're not operable. They don't have to be operable if we can fix it. But how can we do it? How can we mobilize that meniscus so it's moving healthier? All these courses, they came in level ones. So you have your upper extremity, your lower extremity, your spinal course. And once you complete your level ones, you are full body certified. So, and I'm not going to lie, they're intense. Like you saw me while I was taking them, right? Like I would be a harried mess. But they're just so good. You learn so much, but it's a lot of information all at once. 3 days of hands-on, you're learning about 100 protocols for each class you're taking. And then on the fourth day, you are getting tested. You get 10 protocols out of the 100. You don't know which ones you're going to get. You have to know them inside and out perfectly. You are graded on your palpation skills. You're graded on your tension, your depth, the direction of treatment, whether they think it'd be an effective treatment. And it's, if you pass, it's great. You're certified immediately. You are an ART certified provider. But I will tell you the truth, you don't really get good at it until you're doing it for a while. So it really takes repetition. Um, and you are required to take a course every year to maintain your certification. So even after you've taken all the courses, you're still going back. You're still required to take it to maintain your certification for a very good reason, because you can lose these skills. And I find I go to a lot of these continuing ed courses, and if they're not giving me the proper materials or accountability of keeping up with it, like I lose it. I don't keep it. I kind of forget what they taught. And these are very specific protocols. So one of the wonderful things that they do is they give you this Artman app on like your iPad that you can download to your iPad, and it has every protocol on it, like on video form. Then it has the anatomy, 3D anatomy for visual, 3D that you can see and show your patients why you're working there, educate them on why you're doing it. And it's just a way that you can keep practicing. I mean, and you know me, I always had my manuals out all the time. I was always looking at my videos, but it was just a way to keep, practicing, and the repetition like ingrains it into your own muscle memory in your own hands. So it just becomes part of you. But I think one of the most fascinating things about it to me is, and this always blows my mind. And I always tell my kids, you should do something that blows your mind, like just once a week. Learn something that like blows your mind. And this one like got them, but that every single muscle in your body has a unique function. There's no two muscles that do the same exact thing. So there's a protocol for pretty much like most every muscle in the body, like in these courses, and they're all different. And because no two muscles perform the same exact movement, every muscle has its own fiber direction, function, relationship with surrounding tissues. So that's what makes it so powerful because it's so specific. So while I was getting good results doing, soft tissue work before, it was just so general. And when you get more specific, you get your results so much faster. Then you move to level two, which is now not about treating each structure individually, but about treating relative motion between structures. So while I thought I was really good at like releasing a psoas and had that down, now we're looking at, okay, over to the side, the psoas may be stuck to the iliacus or maybe to the QL. And behind the psoas, deep to it, is the anterior sacroiliac ligaments, the anterior intertrorsii. Up above is the diaphragm, the iliolumbar ligament. So now there's 7 different ways you can release a psoas. So now level two takes you, now you're three-dimensional. You're walking in and you're like, oh, I see. I felt like Neo from The Matrix, right? Like I see it. It all just like came together and it just blew my mind. And then here I am doing these techniques and I'm getting, again, even beyond my level one, which was getting things better so much faster, level two, even quicker because it's that much more specific. So I think, we're all going to get there, eventually with the soft tissue. I think ART is just faster and more efficient because we're running out of time to treat our patients. We don't have all these visits. They don't have much time. They need to get back to their lives. So this, like in even athletes especially, right? You see this being happening on the side football fields in the last Super Bowl. I saw them doing a SOAS release like on the sideline there. So you're really starting to see it everywhere. But what I was most excited about was really the nerve course, and because I don't know any other continuing ed place that offers nerve course. There's no nerve courses out there. So that was a huge, huge win.
Yeah, I will say neurodynamics and getting into, oh, how does this all affect? And you're looking in one spot, you got to look at the whole body. This has always been something I've been a huge
Hmm.
advocate of because I'll see people come in like, oh, well, your referral is just for your shoulder pain. Or like, but it's my hand too that's bothering. And I'm like, you got to look at the whole body because it's more interconnected than you could
Absolutely.
ever imagine. And that might be directly related. So fixing one thing. So I think that a good PT is always someone that's being the advocate for the patient too, to be looking at beyond what that referral just got you in for and thinking outside that box and you're not just giving some exercise, but really getting to feel your patient, to know what their body is going through. And they're going to see so much more value in it. I know your patients always spoke highly of you and would specifically wait in line and take their time until they can come see you because you knew what you're doing and you're treating everyone at the same quality of what you would do and giving the same value, that you're looking at all these different elements and you're not just looking at that one muscle that oh, you strained this one thing, why did that happen, why is this going to happen again, and how you can be preventative too with it. So for the more that I'm learning about active release techniques and the different manual neurodynamic skills that can be out there, it all comes together, and at the end of the day it gives you better treatment, better tools and resources in your toolbox that you can give the best quality care that you can. And I think it really stands out when I see you working on patients, that your hands, your mind, but when you expand both of them and you just keep getting better with them, that's that expertise. You need that
Yep.
practice, but
I will say
continue
too,
with
like
that.
I think one of the what I love too about it and what I think would be so great, I think as PTs as a general, as a group, we are amazing palpators, right? We don't get x-rays, we don't get, any reports. We have to see, we have to feel, and that's how we know there's dysfunction. But this really brings you to a mastery level of palpation. So the diagnostic part of it and feeling for the soft tissue dysfunctions and the way they're moving is just as important as the treatment part, and they really teach you this amazing diagnostic algorithm for finding these dysfunctions, and it's been amazing. So I highly recommend it. I highly recommend trying to get your company to pay for it. Or that's what I did. I got NeuroTour, as I work for them, would pay for half the cost of the course. I would pay for the other. I got Twin Bro to start investing in it too because they found it to be a real asset to what I was bringing. I had to fight for it a little bit, but yeah, it is. I think a little pricey, but I think it's absolutely worth it. It's worth the investment.
Yeah, I'm a huge fan of put your money where it's worthwhile, that investment
Yeah,
in it, and then I think that is absolutely I couldn't agree with more with you that that's something that I think if you're interested, if you want to get better with your management skills as a physical therapist, definitely one of those niches that's a huge tool to the toolbox. I keep saying that because I truly believe
absolutely.
that there's certain things like we can learn how to do cupping, we can learn the exercises. There's a lot of things nowadays that people can just go online and get that information and try it on their own. And a lot of times it's a hit and miss, but the information's out there and it's pretty good. But there's certain things with our mindsets, especially as a PT, that knowledge base, what we've built to get to that point, and this is still challenging. Like you said, these are not easy courses to get through. They're going
No.
to challenge you, and then you're still going to push yourself. So you have that general foundation of what you know as a physical therapist, but now to really refine your skills, that's when you become an expert in it. And the thing too is when I'm thinking about a dancer that's in a show that just wants to keep going, but then kind of transitioning to your life in the outpatient, where you get people in some pretty acute pain. And I know that's when I'm talking about manipulations versus muscle energy techniques or how I make that clinical decision on what's appropriate at what time for the patient. When you're seeing someone that's in a pretty high acuity of pain, is there a different approach that you have when you're applying ART to them versus something that you're like, all right, let's do more of a maintenance program at that point?
Yeah, no, great question. It especially on a patient in significant pain, everything becomes about sensitivity and precision. And the first thing I tune into is the patient's real-time feedback, not just what they say. I don't, I try not to go too much on what patients say because it's also in the opposite end. Some patients I feel like have no nerve endings or are so stoic. They don't tell you when there's a lot of tenderness there or when it does hurt. So I really go by what I'm feeling. But as far as I think I find that more so that I have a very brave patients who are like, no, I'm fine. I'm like, well, you're holding your breath, so I
And then
think
they
that
sit
might
up
be
and
a
there's a
little too
sweat
much
mark.
pressure.
It just looks like an outline of a body. And you're like, oh, I didn't know that was that bad.
But going from the feedback, again, not just by what they say, but by what you're feeling, how the body's responding. And ART is like incredibly tactile. So you let the tissue guide you. So if it's inflamed or guarded, I'll start superficially and gently, and sometimes, even working on adjacent muscle structures just to calm the system down before addressing the primary dysfunction. But I'm always incredibly aware of my own body mechanics, um, that I am effectively applying enough tension without compressing too much. It's the compression that you want to avoid. So, I'm very good at flaring my elbows to, I'm getting tissues to move in opposite directions versus like coming in down and really causing like a lot of pain. Because being too compressive, I mean, is going to do the opposite of what you want to do, especially when you're working on nerves. So, high pain cases, I might modify the movement ranges, shorten the treatment windows, break things into smaller sessions that the body can handle without flaring it up. And I just always remind myself the body's gonna give you like what it can give you, not what it won't. Like I'm not gonna force things. I'm not in a no pain, no gain kind of mentality. I think pain is there for a reason and usually to prevent further soft tissue irritation. So I always listen to my patient's pain levels and I don't try and force through that pain barrier.
Yeah, always to the barrier, not through it. A lot of times, I say that a lot to my patients. Like,
Yep.
I can still do it. I'm like, it's not that you can't do it. It's just not necessarily the benefit
Nope.
where you need to do to be able to get doing it without pain. So I tell you, people
Yep.
come in, and a lot of times it's like, and I just have pain. There's a lot of components that go into that, but listening to your patient and getting a feel of what they can tolerate and what's actually appropriate at the right time is a huge thing. So I appreciate you touching base on that. And then just to kind of bring everything full circle with it, you've given a lot of good information. I feel like I've learned a lot too about ART beyond what I've known so far. But if I, and this is more geared, I like asking the people that I have on here to not just focus on getting information out to the general public, but also to physical therapists. So if a physical therapist wanted to kind of dive down the ART path, where would you recommend them look just to kind of get your foot in the door if they wanted to start one of these courses?
Just going to the ART website, Active Release Techniques, and they'll let you know which seminars are happening across the country. One's happening locally here in New Jersey, the ones that's how I started off. And now for advanced courses, I fly down to Florida and Orlando to take my level twos, like, and just make a whole weekend for me, like out of it. But going to the website is a great place to find out where these seminars, and there's so many. You'll always find one close enough to you. Um, it's great to bring a friend It's great to have that partner to study with, because at the end of those 3 days, 5 o'clock, the class is over. You are going into a room full of people and you're setting up tables and you are up to the middle of the night just practicing these protocols on each other. It's like being in college again. And like cramming
Fantastic.
for that exam. It's a practical exam again. It's like, I don't know, brings me anxiety, but other people, once you know what you're doing, it gets a lot easier as the classes go by. But the website's great for finding the seminars. It's also great for finding providers in your area. Like if you just put in your zip code, it'll list everyone who's practicing ART around you. You might want to go and talk to them and see how, they use it in their practice. You might want to get it done on yourself, and just to see how it feels for yourself, see if it's something you'd want to continue.